Welcome to the All About the Medicine podcast with Dr. Nolan Knows. Let's start this podcast off with a little humor. What did the doctor say to the patient who reported that he broke his arm in 2 places? Stop going to those places. Today, we're going to be talking about a medication that is making headline news again. It is getting more attention than A-list celebrities. Are y'all going to invite them to the Oscars next year? I don't know. I think they should. And the name of this famous medication is Ozempic. Ozempic is FDA approved for diabetes type 2, and the other brand name for it is Wegovy, which is FDA approved to treat obesity. A few media outlets are reporting that patients are having gastric paralysis after taking Wegovy or Ozempic. The medical term for this is gastroparesis. So let's discuss exactly how this medication works and some of the known side effects. So let's start off by understanding how this medication works to aid in weight loss as well as controlling diabetes. GLP-1 agonists are a hormone that is produced naturally by our intestines as well as the alpha islet cells in our pancreas. This hormone binds in various places all over the body, and each of the places it binds to, it does something different. In our brain, it says, hey, we're not hungry. The medication binds in our pancreas and says, hey, release more insulin. It tells our liver, don't break down the stored glucose, which is called glycogen. And it also tells our gut and our stomach to slow down gastric motility. And that brings us to the topic at hand. The reason why this drug works so well for diabetic patients, especially those who are obese, is because diabetes type 2 is a problem with insulin insensitivity. You're making the insulin, but because you have so much excess of fat cells, your body is not able to use the glucose that you eat from your food efficiently. This medication is making sure that you're definitely not hungry, you're releasing more insulin, decreasing the amount of fat cells that you have so your body responds better to the insulin and metabolizes what you eat more efficiently. Long before this drug even hit the market, it was a well-known fact that if you had prediabetes and you were overweight, losing just 10% of your body weight dramatically reduced your risk of developing type 2 diabetes. Furthermore, those patients with type 2 diabetes who were morbidly obese, when they got a gastric sleeve and lost the excess weight, a lot of patients are able to come off of all of their medication for diabetes just by losing the weight. So now that we understand how the medication works, let's talk about the topic at hand, which is the complaint that patients are reporting after being on Ozempic or Wegovy that they have gastric paralysis or gastric paresis. So as stated earlier, the medication, the way in which it works, one of the mechanisms is that it slows down gastric emptying. It slows down the food's transit out of your stomach and through your intestines. This makes you feel fuller, longer. It's like a feedback mechanism to your brain. Not only does it work directly on your brain, but your stomach feels full, because it probably is, and it slows down the transit of that food so that you're not hungry and you don't overeat. That's going to be controlling your diabetes as well as helping you to lose weight. The delayed gastric emptying is a known side effect, and actually it's kind of how the medication works. And in the clinical trials, it was reported, and according to the manufacturer, people who have gastric paresis or issues with delayed gastric emptying should not be on this medication. Now, playing devil's advocate, some patients may not even know that they have an issue with that. The symptoms of gastroparesis could be nausea, maybe some vomiting, abdominal discomfort, or burping and still feeling like you taste the food hours and hours after you've eaten. If symptoms were mild, they probably didn't even mention it to their doctor before they got on this medication. So this is not a new side effect, so to say. I'm glad it's getting media attention because patients should be informed of things to look out for when starting any medication. Let's talk about the diagnosis of gastroparesis. Most of the cases of gastroparesis are caused by uncontrolled diabetes, but it can also be caused by viral infections, namely rotavirus, which most of us have vaccinations against it when we were children, but also Norwalk virus, Epstein-Barr virus, also chickenpox. Any viral infection that can cause damage to the nerves can cause gastroparesis. Now, sometimes it's self-limiting and the symptoms can last for a year, and then your body repairs itself and you're fine. But sometimes it can last for a lifetime, unfortunately. Another cause of gastroparesis could be a neurological disorder like myasthenia gravis or multiple sclerosis, or any autoimmune disorder like scleroderma. So it's not just the medications. Medications can cause gastroparesis, but more like it probably exacerbated the underlying gastroparesis that was already there. All medications, over the counter or even prescribed, all of them have side effects. And it's so very important for everyone to pay attention to your body and mention if you have acid reflux symptoms, or if you find that after you ate a meal, you get nauseous, or if you feel like you're still tasting the meal when you burp or something like that hours and hours later. That could be an early symptom of gastroparesis as well. So I've had acid reflux syndrome since I was in college, child. So I definitely know the woes of stomach issues. But what I always have noticed, and it got worse with my pregnancy with my twins, is that I like when it comes to foods that are spicy, or if they're too sweet, or definitely any red sauce I cannot do. It feels like I am still tasting this meal for a while, and I probably have a little bit of gastroparesis, to be probably honest, just openly sharing. But I mean, these are so that medication may not necessarily be the medication for that person. And so when it comes to weight loss, diabetes management, I always think of these things in terms of risk, benefits, and alternatives. Obesity is a diagnosis just like hypertension, just like diabetes. Every medication that could help, of course, doing it the right way, which is diet, exercise, losing the weight on your own, that is always going to be my first recommendation for anyone that has any of those symptoms, because in the long term, you're going to fare out better. Specifically, what I always recommend to patients is that even with these medications, we are going to work on your lifestyle, eating healthier, reading your nutrition label, knowing what foods are whole foods, so that this is not just a medication to help you get to your goal for right now. No, this is a lifestyle, because the goal is always to get you off of as many medications as possible. That's my goal. So a lot of education has to be put into this. And my next topic that I wanted to discuss when it comes to obesity specifically, and weight loss and diabetes. So alternatively, probably like 20 years ago, we all know that losing weight will definitely help with manage your diabetes. And a lot of patients that had diabetes that were super morbidly obese, once they got the gastric bypass or gastric sleeve and lost the weight, we were able to take them off their medications because they didn't need it. That's how much of an impact that losing that weight had. So it was great, because now you have a person, they've lost all the weight, and hopefully they've changed their eating habits and they're healthy, and it's great, right? So as we've gone on throughout the years, because we've been doing gastric bypass surgeries for a while now, we more so do the gastric sleeve. We have data to look at it. So any surgery is a surgery, and it does have a risk of death. That people can have an arrhythmia or an allergic reaction to the anesthesia that we couldn't precipitate, right? So that's why we sign all of these releases before we have any surgery. And every medical journal, every medical board, we're moving more towards non-invasive alternatives to surgery, because it comes with a great risk. So I was excited about any medication or something non-invasive that people can do to improve their overall quality of life and quantity of life. So extend their life, and you're able to enjoy it better. So these medications were very exciting when they hit the market in 2017 and even before, because we're able to get gastric sleeve or gastric bypass like results without the risk of surgery. So when I went and I did a little bit of research for side effects and deaths, so I like to compare pound for pound, right? So when it comes to Ozempic, I did not find any directly Ozempic related deaths. It's zero, but it also is new. For gastric bypasses and gastric sleeves, that gets very complicated, but it's estimated that the cause of death from getting a gastric sleeve is 1 in 1,000. There are way more gastric sleeves or gastric bypasses than that being performed every year. And it may not even be directly like during the surgery, but you have to look at sequelae or consequences of having that surgery later. For example, whenever I do a weight loss consultation, I'm asking about your relationship with food. Are you eating because you're hungry, or are you eating just to eat because you enjoy the taste? Are you eating even past when you're hungry? And the reason I ask that and the mental component goes into it is because I am trying to figure out if it's due to excess calories because you're hungry. So I can fix that. There are various different medications that I can do to fix that. Or if you're eating because you're depressed, because overeating or undereating is a symptom of depression. Or if you're just eating, just binge eating, there is a diagnosis for that as well, and it's called binge eating disorder. So if you have binge eating disorder, the Ozempic isn't going to help. This medication is not for everybody. That's why you're prescribed it. That's why it needs a prescription, and you do a deep dive into that, because the medication for binge eating disorder is actually Vyvanse. It's FDA approved for that. Education is key, and also critically reading. So whenever there's a title that, a certain medication or something causes something, it's a catchy title, but it's important to read the entire article and consult with your physician to discuss if this medication is right for you, as well as divulging all of the side effects of any medication you start, not just this one. It's any one, because I don't know how to treat you if you're not disclosing everything about what you're experiencing on the medication. And actually, those side effects get reported to the drug manufacturers so that they can investigate it further to actually encourage prescribers and patients to be aware of this, so that either you stop the medication or change the medication. So that's a very interesting topic out there right now. And for patients that may be thinking about it or scared, I want you always to do your own research. Talk with your physician. And actually, don't do your own research. Talk with your physician, because even reading these research articles, if I did not have a medical degree or a science background, it wouldn't make any sense to me. So everything is not for everybody. Medicine is not, it's tailored. It's like a tailored suit. It's not a one size fits all. But still in all, this medication is still a very, very good drug for a lot of people. And I even have patients personally that have lost a lot of weight. Their blood pressure is improved, their sugar numbers are improved, and they overall feel better, look better. And that's always my goal. And they didn't have to have a surgery. It's no downtime. And using this medication, also, since it's not, your stomach isn't surgically cut, it gives you the opportunity to reprogram in your brain how to eat and how to eat correctly, and make this a lifestyle change. I hope you guys got the information you came here for and have a better understanding about the medication so you can make an informed decision. Knowledge is power. If you like this content and have some other questions or some other suggestions about what you want to hear, follow me on Instagram and comment, or on YouTube. Thanks for listening to another episode of All About the Medicine with Dr. Nola Knows.